Are you someone always suffering with chronic neck pain? And in combination, you've noticed that your range of motion isn't as good as it is one side versus the other. And into certain head movements, you're always hearing grinding or crepitus in your neck. And usually these people are dealing with problems like this. They also have decreased energy. They get headaches at the base of the skull, cracking or grinding in the TMJ joint, and oftentimes vertigo also. All these problems have their root oftentimes in the upper cervical spine, and somewhere along the line a trauma happened, whether you remember it or not. And what happens is where the head and neck meet, there's two joints, and around the joints is a very fibrous ligament called a joint capsule. And when you have a trauma, the joint kicks out of position, it tears that joint capsule, and you lose stability in the joint. And what happens, because the ligament's not giving the joint stability, the deep layer of muscles contract to kind of shore up that weak area. And then what happens is the muscles lock down, the feedback from the joint into the cord doesn't function properly, and all sorts of systems in the body don't work the way they were intended to. So the solution is to get someone who can find out if you have a structural problem in your neck and then correct it. If this sounds like you, our Neckwise upper cervical clinics throughout the country have specially trained doctors to ascertain if you have this trouble, and then 3D imaging is taken to find out exactly how that top vertebra is locked out of position under the skull, and then a correction is made to restore it into its normal range of motion, which then allows the body to work better. If this sounds like you, comment below, free consultation. We can find you someone in your area that can